Hi, I'm Annie and I'm from Toronto.
I'm Grayson and I'm from San Diego, California.
My father's had 2 heart attacks. What are my chances of having a heart attack?
Well, this is a very common question, the question about family history of heart disease and what's it mean for me. You know, we just finished up the Human Genome Project in this country, and now we have all these genetic tests. And one of the fascinating things is when you combine 100 of those different genetic tests to try and predict the risk of heart disease, it's no better than asking someone, do you have a family history of heart disease? Now, what does a family history mean? It really means someone who's younger in your family who had heart disease, not someone who died when they're 90 or 80, but someone in their 40s or 50s or even 60. It has to be a young person. If you do have someone who has heart disease in your family, that doubles to triples your risk of heart disease yourself. Now, this is the most important thing I'm going to say. It's this nature versus nurture argument. It's not all genes. You have to view this family history as a gift. It lets you know that you're at risk, and then you can in turn reduce your risk of heart disease. Really, the people with a family history of heart disease, they're the ones at most of risk of dying because of diabetes or high blood pressure or obesity. If you get rid of those kind of nurture things that are in the environment, you can dramatically reduce your risk of heart disease. So having a positive family history of heart disease doesn't mean you're automatically going to get heart disease. It's a wake-up call, and it means that you're the kind of person who has to pay particular and special attention to risk factors. If you do that, you can get rid of that risk associated with your family history.